where everybody, again, unbeknown to me, had got a one side of printed paper of everything they were going to read out. I hadn't got one. And then, because of this announcement in London, all of a sudden, the whole of the media attention was not on a local thank you, but on why was the public health advice to wash your clothes at this number of days after the incident. And so if you look at that recording very carefully, you will see that I'm very confidently reading from a completely blank piece of paper, which I had in front of me. And I learned that to improvise quite strongly.
Welcome to the next in our series of episodes launched in partnership with the Faculty of Public Health, aiming to explore one key question: what is public health? This series aims to shine a light on the huge range of work delivered by the diverse public health workforce as we talk to key figures in public health from across the UK and explore this question, as well as what inspired them to go into their career and what they think are the key challenges lying ahead. My name is Josh Howkins and I'm a Public Health Registrar. Today we welcome Professor Dame Jenny Harries, Chief Executive of the UK Health Security Agency. Jenny has played a key role in many of the most significant threats to UK and global health faced in recent memory. She was the Deputy Chief Medical Officer for England until she was appointed the first Chief Executive of the UK HSA. At that time, in early 2021, a newly formed organisation tasked with protecting the health of the nation stood up in the midst of the most significant infectious threat to health in recent memory. She brings experience from regional and local roles as well as from outside of the UK. Jenny, really happy to have you here with us today. Thank you.
Thanks, Josh. Good to be here.
So our first question, which is a tricky one, I know, is what is public health in your words?
So you did give me a helpful indication you might ask me this. And the one that obviously I learnt when I was a very much younger registrar was the one of a science and art of preventing disease, prolonging life and promoting health. But actually, I think it's much simpler than that. I think myself and colleagues are driven simply by something which is to do with improving people's lives. And actually, health is the biggest resource in all sorts of ways that anyone or any community or any family can have. And for me, that is the driver. It did take me back a long way because when I came into public health and relatively late in life, actually did the public health training, I had to fill in a form or an application for what was then the Welsh public health training stream. And I did Latin at school before I went off to medical school and managed to combine it all by quoting Cicero, which was Salus Populi Lex Suprema Est, so that the health of the population is the highest law, or however you want to take it. And I think that's actually right. So it's a societal law, I think, that we all need to improve people's lives, and public health does that for me.
I'm glad you translated your Latin because I was trying my best. That's a really nice answer. I think it's a really tough question, isn't it? But it's a nice answer, and it sounds like what has driven you from what I know of your career so far. And I think it quite nicely leads on to the next question of what attracted you to your career in public health. I think you might have touched on it slightly, but can you expand?
I did, and my apologies to anybody who's listening who was at the UKHSA conference this year, because I was asked a similar question. I think I started entering public health at a point where perhaps a lot of medical graduates do, which was you'd be working in accident and emergency, you'd see families coming through, individuals, and you started to think that actually much of the poor health that they came in with, life-changing interventions, particularly strokes in impoverished families. And you thought, actually, there are things that can be done upstream that would mean the likelihood of this happening for this family would be much reduced. And I think I was probably quite naive on the political front about how political some of public health is, but actually that opportunity to support populations to have to choose and being able to have better health for themselves and prevent that downstream negative impact was something which really drove me. The other thing which I mentioned at a conference was, as a medical student, I, without realizing I had an interest in public health, actually, chose and found funding and developed my own study almost. It was very crude in the sense of I would never describe the populations I was studying in the way that I did now. It was very insensitive culturally. But at the time I was training in Birmingham, there was a maternity hospital, Sorrento Maternity Hospital, that mostly had a very high proportion of Southeast Asian babies from individuals moving into the West Midlands. And then I went out to do some maternity in Chandigarh and in the Punjab in India, and then separately went out to look at Asian baby birth weights in Nairobi in Kenya. And I broadly constructed my own study, never published it. And it was the days where we had typewriters, not computers. But you could see, for example, by very crude assessment of the religious or family backgrounds of babies based on names, family names, that you could see, for example, that Hindu family babies in Kenya were the ones who had the highest birth weights. They were the lowest in India, but they were lower in the UK than they were in Kenya. And this, of course, reflected socioeconomic status in the relevant populations. And I got quite hooked on public health from that.
It sounds like in your head, the questions you were trying to answer, so you were aware of the upstream and the downstream effects, and you were aware of socio-demographic effects on birth weight, but maybe we're still just finding your way in this, in public health, I suppose.
Absolutely. I don't think I actually realised there was a career which was called public health. I was just sort of enticed in by the differences, and of course it's those differences which then you can see are just really unfair in societal terms, that then I think drove me to not only to want to study it more, but actually to do something about it. And I did very much look at doing academic public health. That didn't last long. I had a plan. I was going to go and do a PhD and all sorts of things before I'd come out of my training scheme. But in reality, what I found was plenty of brilliant people were doing absolutely superb academic public health, but much of it was not being translated. And so my career very much is focused on taking that excellent work, but trying then to use it systematically in health services or now in health protection work.
Thinking about challenges within public health, I mean, there are many, and I know you've spoken on many as well, but what public health challenge do you think we're not talking about enough currently, and why?
So you're interviewing me on the day that UKHSA has just published the health effects of climate change report. And this is an area which I think is fascinating in both a negative and positive way. So it's taken a while, I think, for people to understand the impact that climate change is bringing and is going to bring, because even if we manage that climate change globally, we will still have negative impacts accruing until about the mid 21st century. So, this is something which is unavoidable, and that's why it's something which we have to talk about. However, it has all sorts of repercussions. I think the breaching the 40 degrees in the UK the summer before last was a real eye-opener for some people. For public health colleagues working in this area, until that point, it's sometimes been quite difficult. Space in the media, do we really need to have somebody to tell us we need some suntan cream and a hat and it's a hot day? And the answer is yes, we do, because quite simple things will protect lives. But the impact of climate change it's the background context for which all of our public health intervention needs to be managed and assessed against. So it is so far reaching. So whether it be adaptations for housing, for example, in this country, whether we are thinking about chronic disease, the impact of an aging population, and then heat impacts or cold impacts still, which will still be going forward for the next few years, whether it's about extreme weather events and getting geared up for flooding and response. Are we building cooling systems, ventilation systems? We've just been through COVID, but we're thinking about pathogens. We're not necessarily thinking about heat. And then, of course, one of the things which the media is now getting very familiar with, around vector-borne disease. So things which were, when I was a child, were tropical diseases, I think for my children's generation are going to be normal diseases in years to come. It's fairly predictable. And so there's a whole load of behavioural science that we need to learn, and we can do that proactively before we are burdened with many of the problems. I think the final point I'd just say on this, it sometimes comes out as a very negative story, and clearly, it's probably not my focus in this job to be on the wider sustainability agenda, but purely from population health and health protection, there are things that we can do. And I think one of the most disarming things, and most worrying points for our younger generation is that there's a problem which often the younger people can see very vividly. It's their life and their children's lives ahead. But nobody's giving them the answers to what they can do about it. And so the work that we're trying to do now is to identify an evidence base, or at least carry out research if there isn't one, about the things that we can do to mitigate climate change. So that's my big passion for this year going forward, to positively interact, inform and intervene wherever we can.
You mentioned the Health Effects of Climate Change report published today. UKHSA published a lot, the comms, the communications attempted with the wider public. Really, anyone who might be interested is quite a strong aspect, I think. Is that something that you've worked on to try and, you talk about your sort of speciality, your interests are in applying evidence. And I think a big part of that is translating and communicating that evidence. And it seems to be something that we as UKHSA are quite strong at, would you say?
I think so. I mean, we have a remit. So we have a remit letter, what the organisation is expected to deliver. And one of those remits is very much about working with the public and with other professionals and organisations. There's a warn and inform requirement around health protection, particularly. For me personally, it's really interesting. If we're talking about careers and why people might be interested, one of the best things I ever did when I was a registrar, trained in South Wales, we had an E. coli outbreak, which very sadly led to the death of a school child, a 5-year-old. And in that, it was quite a big incident for Wales to be dealing with. And I was assigned to work, because of my clinical background, to work with the director of communications, who was responding to all the media, in order to make sure that I could translate through for him all of the get the clinical terminology correct and the tests and everything else. It was the best thing I ever did in all of my training. And I literally became the interim assistant director of communications, not a public health registrar, but that's how it was. So I was dealing with media. I didn't necessarily do media interviews myself. I've clearly done much more of that in the last 2 or 3 years. But I think what it taught me was to see things a different way and to ask myself questions as to how a reader would see this, depending on which background they came from. Would it be understood by a child, by a mum, by a hospital doctor, whoever it might be? And so that's ability to see both the opportunity of communication, but also the pitfalls as well. You have to think one step ahead as to how something might get translated and try and prevent that coming out negatively, and using it it's a great opportunity and a window to support good public health and to help the public help themselves.
I was thinking about your public exposure, particularly around during the COVID briefings early on in the pandemic. You were quite often in front of the camera, which I think is huge, isn't it? For in public health, we may, as you say, do radio briefings, we may publish academically or more publicly, but we are often just a name on a page, and it's not personal, recognition or sort of character recognition. But you were up there, you were in the public eye.
Yeah, I mean, it was very challenging, and actually continues to be, because as many listeners will probably say, I don't think I ever anticipated I would be standing at a number 10 podium next to the Prime Minister or the Chancellor in the middle of a global pandemic. It wasn't on my to-do list at all. But it is a huge privilege, and my focus at the time, I mean, many policy decisions would have been made before I stood on the stand. I would have contributed public health advice It won't always be accepted. Some of it is, some of it isn't. A policy decision comes out, and then you are there with the opportunity to speak to the public at a time when many of them were hugely frightened and were looking for some very simple messages in a very complex world. And so when I was communicating, I was trying to, as well as remember the latest on everything, because you could be asked almost anything, I was trying to actually go back. I always try and put my Director of Public Health hat back on, because that's a great starting place, whether I'm working nationally or locally, and say, if I was back in Norfolk or Swindon or wherever I've been a public health director, what would I say if there was a family or a community near me? What is it, the message I think they would want to hear? And I tried to communicate that with that approach. I did do one or two things quite specifically. So, for example, on all the media briefings, although I had a professorial title, I didn't use it intentionally. I felt that out of a CMO and two deputy CMOs, three professors might be too much for the population to absorb. And I thought it may be, people enjoy different connections. So many would link with JVT. If you were a football fan, that was an obvious one. I know I had quite a strong appeal with people's mums, it seems to be. But I think having somebody who's just Dr. Jenny was actually probably a helpful alternative focus for them to try and get some clear messages out. It is difficult. It's difficult to not to get confused with the politicians as well, if you're there as a public health professional. But I hope what I do, and I do get feedback from people still, actually, I bump into them in the street, where they wanted some very clear messages. And it's been really helpful for me to hear back from them what was most important to them. And I try and take that now into all my media, and, particularly where we've got an incident running.
Thinking about, you may have already covered it. I don't know if you've got more significant events. I'm sure you may do, but an important event or situation that has been significant to your development as someone working in public health. Did you have an example for us?
Yeah, I can almost identify a moment when I was dealing with a gentleman who'd come into A&E and had a stroke, and his family set out. He'd just retired. They were about to go and drive around in a camper van, life's ambition, and it was all cut short. And the more I heard about the family, the more I understood how difficult life had been. And then almost as if everything had befallen that one family, excuse me. And so there was definitely a reality moment. I hadn't had any illness in my family. I wasn't particularly from a wealthy background. I was the first woman in my family to go to university. So, it's not an unusual background, but this really brought home to me how ill health and societal problems impact in very focused ways, in very unfair ways on parts of the population. But I think if I go to the other extreme, my only, apart from, prior to the pandemic, the other really main event I remember was I did do one significant public communications intervention, which I look back with horror now, but it was in the Novichock incident in Salisbury, and I was the regional director for the Public Health England for the south of England, but I was actually working to cover and support the medical director, Sir Paul Cosford. And I think local people, the first part of the incident was perceived to be over, and they were doing what was effectively a thank you to local teams and staff, and they'd got some local media, and they were very keen to have somebody more senior down. So it was on Saturday, I'd driving down to Salisbury, and unbeknown to me, I just before I left London, the then Chief Medical Officer, Sally Davies, had gone out with the head of the police to give some advice about local people washing their clothes. Now, this was quite a few days afterwards, and there was a good reason for all of this, which I won't go into. But the end result for me personally was I ended up going into this media room where everybody, again, unbeknown to me, had got a one side of printed paper of everything they were going to read out. I hadn't got one. And then, because of this announcement in London, all of a sudden, the whole of the media attention was not on a local thank you, but on why was the public health advice to wash your clothes at this number of days after the incident. And so if you look at that recording very carefully, you will see that I'm very confidently reading from a completely blank piece of paper, which I had in front of me. And I learned that to improvise quite strongly. And then in the intervening time, the local media had become international, and I'd got inquiries coming in from Italian broadcasts and all sorts of other places. So it was a quite, it probably did give me a little bit of insight as to what was going to happen in the pandemic, but I got through and out the other side and realised you needed to think very, very carefully when you were in front of the media.
And I guess improvisation has a role to play in that. But I think, as you mentioned earlier with the COVID briefings, I would certainly imagine there's a lot of prep that's gone into that, which makes the improvisation is more just bringing together ideas that are a sound public health advice, which I think you had good feedback from in those COVID briefings of sound advice that people could understand and could follow.
I think that's right. And you are in a very privileged position speaking to the public, and that is a great opportunity to improve the public's health. It's also, responding in health protection. So if you've got people watching this who want the exciting, rapid moving part of public health, clearly you need to come to UK Health Security Agency because it all happens here. It can get very exciting, and there's some quite fast moving action as well.
Always worth having an advert. And I think this and the breadth of things that you've spoken about are a good advert broadly for public health in general as a career, as an option. Final question: if do you have a career tip for people starting in public health training or a career otherwise?
Interesting, because I look back now and think, what would I have done differently had I known what was around the corner? So there are a few, if I'm allowed. And the first one was, I got very frustrated during my public health training. I felt some areas of it were a little bit tick boxy. There are things which I recognise, we will need to learn and ensure we've reached a certain standard, and totally support that. But I also did my training over half time. So it was a 10-year training programme. So it was probably me getting a little bit tense about, anxious to get to the end. But the minute I came out and became a consultant and had the opportunity to strategically influence policy, people's lives, programs in local authorities, that changed instantly. So number one is don't give up on the way through. If it doesn't feel quite right, there are so many opportunities once you're through that basic training program that almost anybody from any different background will find something really, really exciting to do. Then I think when you are in public health, I always say that you can have a ticket to everywhere and to everything. And sometimes you're the only person who can do that. So, for me, for example, I've worked as a chief officer in local authorities. I've worked in specialised commissioning. I've worked in primary care. I've worked in local government, national government. I've supported all sorts of things. I've worked overseas. There are so many areas. I've worked on particular programs, whether it be on physical activity or whether it be on nutrition. So many different areas where I can go into a room and start connecting really critical pieces of information, programs of work to improve lives. And I would not underestimate how valuable that is, because often people will come from a single background, and in public health we're often privileged to come from many and to learn a much broader skill set. And then the final one, the really critical one, is always to be humble. I continue to learn on a daily basis what other people are doing, what programs of work are happening, what skills I need to do different things. And so going in and recognising other people's skills as a priority, well above what you bring into the room, is really, really important.
Yeah, thank you. Couldn't agree more. I mean, also inspired by what you're saying. And I'd just like to mirror, we're very, very lucky in the training scheme, and I think broadly within public health, the wide range of jobs we can do and that are done in public health. And I think that's mirrored in some of the roles that we have are connecting those threads that you mentioned, because it's encouraged to get that breadth of experience, and then from that we can bring that experience together to help, you know, coordinate or strategize or you know, lend a different viewpoint into conversations which are so vitally important if you talk about, as you're saying, you know, healthy lifestyles or best start in life, or health protection and protecting the nation from infectious diseases. They're such important and fascinating questions, aren't they?
I think when I was training, I never quite imagined I'd be a consultant, and then I didn't imagine I'd be a director of public health. I definitely didn't imagine I would be in this role, and it's a great role to do. I've had a great career in public health, whether it be working in a small village in a Welsh valley or just coming back from COP28 actually in Dubai. So the world is your oyster if you're a public health professional. So I'd encourage you all to go and sign up.
Thank you, Jenny.